Dr. Kevin Giangrasso is a licensed clinical psychologist and founder of Bergen CBT, which is a therapy practice based in Midland Park, New Jersey. Dr. Giangrasso specializes in treating children and teens with anxiety. Dr. Giangrasso was voted as one of New Jersey's favorite kids doctors for 2019 in the New Jersey Family Magazine. Thanks for being here, Dr. G.
Oh, it's my pleasure. Thanks for having me.
So your practice is called Bergen CBT, and CBT stands for Cognitive Behavioral Therapy. What is that exactly, and how does it work?
Sure. So cognitive behavioral therapy is an approach to therapy. It is it tends to be a pretty problem focused approach where we look at problems and how to help people either overcome those problems or maybe reduce problem or barriers in their life. And there's three parts to CBT. We look at the thoughts or the cognitive part, and we look at changing people's thoughts to help them be more effective in their lives. We look at behaviors or what people do, and we look at changing what we do in order to help support a person. And then I always say the therapy part is the feelings part, and that's the third. We identify emotional reactions and emotions that we have, but typically we look at the ways that we're thinking about what's going on and the ways we're acting around what's going on in order to help ourselves to feel better in CBT.
Okay, and how can CBT be applied to sports?
Sure. So, I mean, I think CBT fits right in with sports because when you're talking about playing sports, you're talking about performance. And performance is based on how we think about how we're doing, say, in a particular sport, in a particular game. And actually the actions or the behaviors that we're doing as part of that sport or part of that game. And so CBT can, I think, can help us think more positively or more effectively about how we're playing, with techniques such as visualization, or or some other thought-based techniques. And also there are things that we can do in terms of practicing behaviors or actions in a specific way so that we can, the athlete can get more out of themselves and ultimately do better in their chosen sport.
Would you mind providing an example of how CBT helped one of your patients that was an athlete?
Sure. Yeah, I'd be happy to. So I can think of a number of different people, young people I've worked with to overcome specific performance anxiety when it comes to sports. So I think baseball is a pretty good example. So baseball is one of these sports that when you get up to bat, it really is like you're on stage, and sort of that whole game is kind of focused on you and the pitcher for that moment or that set of pitches. And I've worked with individuals on how to overcome anxiety or stress in the moment of being at home plate. So when it seems like everybody's eyes are on you, and sometimes people, don't do their best because they are maybe worried about what's going on, or maybe worried about that last at bat that they just had, and kind of stuck in the past rather than focusing on what's right in front of them, which is the baseball. One really good technique or skill for that kind of situation is what I just referred to, which is visualization. So imagining what it's going to be like when you're in that performance situation in the game before you're actually in the situation. And imagining yourself doing really, really well, noticing the sights and how it feels and all of that kind of thing. And then when you're really in that situation, you can call back on that memory of how you visualized it, and it actually helps.
So, do you think visualization is a good way to counter stress and anxiety?
It can be. I think it really can be. And in CBT therapy, we are. It's almost like every skill or tool that we're trying out is like an experiment. And so we say that and we approach it that way because not every tool or technique is going to work for every person. What we do is we try them out and we say very clearly, like, if it works, stick with it. And if it doesn't work, it doesn't mean you have to keep using it. So I would say for some people, visualization really, really helps a lot. For other people, it might not, but I think that's one of the ones, on the list of tools, that's at the top of my list for working with kids who are playing sports.
I see. And stress and anxiety are not the same things. How are they different? And would you provide an example in sports of how, like, both of them?
Sure, sure. So we use those words a lot when we're just talking with friends or with family, but they actually are different. And in the office or clinically speaking, the difference is pretty clear. So stress is when is the type of experience that a person has when they have something that is causing discomfort or causing they're not looking forward to, or something is uncomfortable about that experience. With stress, the that reaction goes away when the thing that's causing it also goes away. So, for example, if you have a big game coming up and you're feeling stressed about that game, after the game is over, the stress goes away. Anxiety, on the other hand, is a little bit different because if you're experiencing anxiety about a big game that's coming up, after that game goes away, you still feel the anxiety. The anxiety continues.
So, do you think anxiety is a worse than stress?
I don't. I think about when I think about one being worse than the other. I'm not sure because I think everybody experiences these things a little bit differently. I would point to the the intensity of the stress that someone's experiencing or the intensity of the anxiety that someone's experiencing. So, for example, if someone's someone's having a lot of stress because there's a lot of different things in their life that are all stressing them out, then that might be worse than someone who's anxious, but they're only anxious about one small thing that's going to go away pretty quickly. And vice versa, if someone's feeling anxiety about a ton of different things in their life, but the the other person is just feeling stressed about one little game or one thing, then the anxiety is worse. Does that make sense, Brandon?
Yeah, it does. And
Okay.
what do you suggest for someone that goes through performance anxiety?
So that's a really good question, Brandon. And like I said before, I don't think there's a one size fits all solution to any of this, but there are some things that are commonly helpful for most people. The first one I would say is understanding what's causing the performance anxiety. So the if someone has had a bad experience and then they kind of don't want to go back to that sport because they had a particularly bad experience with the sport, then the prescription for helping that situation would be to build up and kind of get back on the field or get back on the court, and do it in a safe kind of way. On the other hand, if someone is experiencing performance anxiety because they are convinced that they have to be the absolute best, say, soccer player on the field every single time, then that's going to take a different set of tools. And we might look at kind of shifting some of the way that they're thinking about how they're playing and what's important to them as they're playing.
I know you touched on this before, but do you think CBT is a good therapy technique to for people with performance anxiety?
I think it is. I think it is because it's an adaptable set of techniques. When someone has performance anxiety, it's not a one size fits all, and CBT has a really practical way of hitting on what's actually going on for that person.
So, from your experience, how long does CBT or any other therapies take to be effective?
So as a rule, CBT therapy tends to be pretty effective pretty quickly. The How effective it is depends on that person's goals. So there are some people who might come in for a sports performance type issue, and it actually might be 1 or 2 sessions, and it's not that you know everything is completely solved after those 2 sessions, but they get enough benefit that they really are able to do what they want to do within their sport. On the other hand, there are other people who have specific issues that we might work on for a series of months at a time. But overall, it tends to be a more short-term approach to therapy. And so we're talking about months versus months, not years, I would say.
I see. So, let's talk about stress and anxiety in general, since it seems to be a concern for a lot of young people nowadays. Do you
Sure.
think younger athletes nowadays have a lot more stress, or is it more in high school athletes?
More stress as compared to the past.
Yeah, and just in general.
Yeah, I mean, listen. I think that there is a lot of stress out there these days, both for younger athletes as well as those in high school. I think that stress can start. Certainly, stress can start in elementary school, and it can continue and it can get worse. Sometimes it gets better. So sometimes when actually oftentimes it gets better. If someone might experience stress and stress related to sports, specifically like in third or fourth grade, through that experience they learn how to manage it and deal with it, then they might actually not experience as much stress as they get older. But in it was like sort of a long answer, but the short summary is yes, I think stress is a real problem for younger individuals as well as those in high school.
What do you think those main causes of stress are, like the stressors?
I think it's my kind of view, or I think that there's a lot of pressure on kids these days. There's a lot of expectation for even very young kids to do a lot of different things. We're expected to get all your homework done. You're expected to join a lot of different after school activities. You're expected to have friends and have a social life, and also potentially learn a musical instrument, learn a second language. There's a lot of high expectations, and that offers a lot of opportunities for things to develop stress about. And I think that's the reality today, for people.
What is your solution for people that feel overwhelmed with so much to do?
I wish I had a magic wand where I could create a solution for someone, for so many kids who have so much to do. I don't think it's that simple, but I do think that there are pros and cons to having a lot to do. The pro is that you learn to manage a lot of different things, and stress is one of the ways that you can learn, because if you don't have stress, you don't have the motivation to learn. If you do have stress, you have something that you have to learn to get over, and by doing that, you learn how to be really successful in your life, and that can be a real gift for later in life. I sometimes think about stress and anxiety as we try to flip it and try to think about it actually kind of like a superpower. Because if we if you have stress and anxiety and you have the skills to manage it and deal with it, you can actually use it as fuel to perform better.
That's interesting. Could you go in more depth about that?
Absolutely. Everybody in the world, no matter what you do or what your age is, you experience stress. It's a normal experience. In fact, if we didn't have stress in our lives, we wouldn't be pushed to do anything. If we didn't have stress in our lives, we might actually sit on the couch all day, because there would be nothing kind of pushing us to get up and to complete an activity, because we wouldn't really mind if we didn't. And so stress can happen at low levels, so we can have a little bit of stress, we can have a medium amount of stress, or we can have a whole lot of stress. And there's when we have too much stress, it can become a problem. But when we have just the right amount of stress, it actually helps us to perform at optimal levels for a lot of different reasons, one of which is because it can be something that motivates us. And actually, there's research to support this. And if you were to mathematically graph out intensity levels of stress, there is a graph that you can follow that says as stress goes up, performance also goes up to a point. And there is a point at which it's sort of the word is optimal, or the best possible amount of stress to get the best possible performance that you're able to. And that's been shown. It's been shown multiple times in the research, and there's certain technical names for it that I won't get into, but there is a best level of stress that people can get to, and that's really when you are you're able to, especially as an athlete, perform at your best. Actually, when you're at that optimal or best level of stress, you can often see, you can literally see better. In other words, your eyes are more clear, and you can see things, like for example, if you're playing soccer, you can see the ball better. You can see where the goal is better. And you can, there's all kinds of other actual body changes that can be measured that help you better play sports when that stress level is at the best sort of point.
So you talk about that optimal stress level. How does a kid, how some kids might not realize when stress goes too high,
Yeah.
and it's getting out of hand. So what do you advise for that?
So, what I advise is to develop your superpower. So, just in the same way that you don't, you don't go on the soccer field on the first day, score 5 goals. You have to go to practice, and you have to work on it, and you have to learn how to dribble well, and you have to learn how to kick it in a way that the goalie can't catch it. That happens over time. And in the same way, finding your optimal level of stress happens over time. So as you practice, there are going to be certain days or certain games when you realize you tipped over to too much stress. There's going to be other times when you maybe go home and you think, well, I didn't actually put my best effort out there on the field. And over time, you're going to learn by playing the sport and by being aware of how much stress you're feeling. You can actually learn to maybe dial it up a little bit or dial it back. But having the experience of sometimes having too much stress helps you in the long term. I don't know if that makes sense. Please
Yeah,
feel free to ask clarifying questions if that's
yeah, of
helpful.
course. And for those who don't know if they have stress or anxiety, what does it feel like for an athlete besides like that performance stress or performance anxiety?
Sure. So, stress, anxiety, or actually excitement are all based in what's called physical arousal. So, physical arousal is another way that I say that I like to say that is becoming activated physically. So, you might notice your heart beating faster. You might notice that you're sweating more. You might notice that maybe your face feels flushed or hot. Sometimes you notice that you feel a boost of energy, or you feel a boost of power. Physically, that's how it feels, and the way that we interpret it or what we do with that physical feeling determines or shows us what that experience is going to be. So the you get typically the physical feeling first, and then the way that you think about it determines whether you experience it as stress, as anxiety, or even as excitement, or feeling like a boost of energy. So it's what you do with that physical reaction that that makes you that makes up your experience.
Okay. And is there a common warning sign or some signs that indicates too much stress in an athlete? And what would you say to these young athletes?
Sure. So I mean, some common things that people experience when they're feeling too much stress are maybe stomach problems, maybe feeling sick to your stomach, or feeling sort of butterflies in your stomach, but a little bit more or a little bit worse than butterflies in your stomach. Sometimes athletes actually throw up or vomit before games. All of these kind of physical signs are maybe signs that the stress level is too high or it's lasted for too long. The other thing that sometimes comes up is athletes try to avoid games or practices, or just not feeling like going. When maybe an athlete used to love a sport and starts to not be as interested, that may be a sign that the stress related to that sport is getting too high.
Okay. And what do you think about social media? Does it cause more stress and problems for kids?
Social media is a tough thing to really understand, because on one hand, these days social media is the norm. It's another way that we communicate with others. It's the way we keep and make and maintain friends. On the other hand, because we have social media, it gives us so much more information about everybody around us as compared to what we used to have. And so it can be tough, and I think social media can create more stress if we pay a lot of attention to it. So a couple key strategies that I recommend are turning social media off at certain times. So particularly, even though it's hard, turning social media off at night when you're going to sleep or when you're almost asleep is a good thing, because it gives you the break that you need. Maybe there's another part of the day when you might want to turn your phone off or turn your social media sites off, just to get a break from that input of information.
Do you recommend an athlete ever just cutting social media out fully? Even though it was aimed towards older people for their kids, what advice from that could be geared towards kids that you talked about?
Sure, sure. So yeah, I did that talk, and I'm actually doing a series of other talks this fall. Going to be doing one focused on more focused on elementary, and then I'm going to do another one on high school. But I I think it's important to for kids to be aware of how they're feeling and what's impacting them. And I think it's also important for them to know that even though sometimes when there's a difficult experience, or you're experiencing too much stress or too much anxiety, or just overwhelmed with the amount of things that you have to do, it doesn't have to last forever. And there are things that you can do to change how you're feeling about the things that you have to do, and to change, you know, how you're doing, maybe in those sports or those classes that you're worried about.
That sounds good. Those are all my questions, but do you want to add anything else?
Well, no, just thanks for having me. This has been a really interesting discussion, and I think you have a great podcast, and a great target here with talking about stress and anxiety. And yeah, thanks for having me.
It was great speaking to you, Dr. G, and I learned a lot, and I'm sure our audience did too. Stress and anxiety is an important topic, and I'm glad we could get it out.
There are certain times when I would recommend cutting out social media. Um, And I would actually recommend doing it as an experiment. Like, just because you cut out social media doesn't mean you have to stay off of those sites forever. But it might make sense to try it. Try it for a day or two and see how you feel. And if it helps you feel better, then stick with it.
Okay. And what is a common myth or some myths about stress and anxiety that you want to clear up for our audience?
I think the number one myth about stress and anxiety that I hear is that stress and anxiety is all bad. I think people think about stress and anxiety as, like, if they are there, then that's like a really bad thing. And I really think that's a myth, because stress, but either stress or anxiety or both, can actually really be helpful to us, as much as maybe it doesn't feel like that. These experiences can teach us how to manage multiple things, and, as you know, I was talking about a little bit earlier, stress can actually help us improve our performance. So I think it's a myth that stress and anxiety are all bad.
I see. And my last question is that on in May, you had a parent discussion about stress management for youth at home during COVID
Yeah.
at the